The first series of cholera in Nigeria were reported between 1970 and 1990. Now, despite this long country experience with this condition, the disease has remained endemic in the country with periodic outbreaks that have left many victims dead. Now, latest statistics from the Nigerian Center for Disease Control, NCDC, indicate that this year alone, the cholera epidemic has claimed 1,110 lives across 29 states in the country. And perhaps still counting. Quite worrisome is the analysis that cholera casualty this year is more, at least 10 times higher than the 84 deaths recorded as at week 43 of the year 2017. Now, this is despite the fact that cholera is preventable with the use of vaccines, through robust as well as consistent immunization programs, and essentially the practice of good hygiene. Most vulnerable to cholera outbreaks are children as well as adults in poor communities with such awful sanitary conditions, as well as contaminated water supply. How can cholera be prevented? Can we manage the situation? Can we get utmost treatment for everyone? Actually, let's reach out to some of the states that have been on that forefront. Well, this is our focus today on Nigeria Today. Welcome to the program. My name is Blessing Abu. Joining us in the studio to discuss the updates on cholera, we would like to welcome Dr. Isaac Eboja. Dr. Eboja is a public health expert. You're welcome to the program.
Thank you. Good evening.
Also joining Dr. Eboja is Dr. James Okediran. Is also a public health physician in Abuja. Thank you very much, Dr. Okediran, for joining us in the program.
Thank you, presenter.
Yes, sir. Let's kick off. I know most people want to assume they know what cholera is, or we just want to, let's not take it for granted. We'll see some other things presenting itself in some of these symptoms or manifestation that we get to see. Let's start with you, Dr. Okediran. What do we mean when we say, okay, there's a cholera outbreak, and that does it rub it off, or no, or does it rub off on everyone who is affected?
Thank you very much, presenter. Actually,
Blessing is my name.
Oh, sorry. Thank you. Very well. Cholera, it's an acute diarrhea disease, and it comes in, it's a bacterial infection that affects anybody that comes in contact with, and ways of presentation. Individual may have no symptom, may have mild symptom, may have severe symptom.
Symptoms such as?
Well, most of the time it comes with vomiting and acute dehydrating diarrhea, which could be very debilitating for those that have the severe infection. And toxemia comes in, and later shock comes in. But basically, an individual may have no symptom, may just be a carrier, or maybe somebody convalescing. So that's why one of the dangers associated with it is that people that may have no symptoms may be excreting it and passing it across.
Very strong one. Dr. Eboja, yes, great enough. We had the same topic, sometimes one of the edition of Nigeria Today. And there's much more cause for worry from the last time you spoke with us on this program. What have we seen from the outbreak we have now in 29 states? Over 1,000 deaths? That's quite high.
Yeah, one of the reasons, some of the reasons could be the flooding that we've been experiencing in the country. When we have flooding and the environment is contaminated, and children, even adults, get to drink contaminated water, cholera outbreak can take place. The other is the displaced people that are scattered all over the country. Their sanitary conditions are very poor. The number of IDPs we have now seem to be more than what we had before. I'm not quite sure that it is much higher than what we had in 2017, and that's the reason why I'm a little bit alarmed and worried that rather than the figure coming down, it has gone up from 2017 to what it was, 800 and something deaths, to 1,110 in this year, and we have about 2 more months to go, or at least a month and a half to go.
1 month and a half.
We just pray that nothing more happens than what had already happened. I also think that Nigerians may have been more sensitized now as to what to do to prevent cholera outbreak and also, if it takes place, what to do to prevent deaths.
If we have such, why are we still having, well, other reasons could be adduced to that. Is sensitization what we have enough from the look of things?
No, certainly not. If it were enough, we wouldn't have the situation that we have now. I think that the management of the disease is still very poor. We may need to vaccinate people now more than we used to. In the past, it was only those who were traveling that were compelled to have a cholera vaccination. It was not a routine. From the way things are going, and in certain states in particular, we may need to have routine cholera vaccination for everybody. But what is most important is the prevention. Okay. Which we will talk about more as we go.
Definitely. Well, we'll as well start off with Doctor. I know you get to see the different patients and the different presentation they come to your clinics or at least wherever you work. What are your findings or what are your observations from the talks you hold with your patients from time to on the field too? What are your observations from how people day-to-day living and all of that could predispose them to such outbreak?
Well, basically, like I said earlier, it's an acute disease. So most of the time, when there is an outbreak of diarrhea disease, until otherwise proven, you have to suspect cholera. And like he has talked about it earlier, it's a disease that occurs due to poor sanitation and hygiene. In fact, sometimes we say it's where there is poor economic development, cholera bound to take place. So in Nigeria, with the movement of people across border, people that are displaced internally, because when they get to where they are and there's no adequate provision for them, basically they may come down with diarrhea disease, and most of the time they may come down with cholera because the mode of transmission, as we all know, is fecal-oral. So it comes in, and human being is a reservoir. So humans, flies, food are the culprits.
So do we have enough vaccines? Do we have enough for people to actually, at least for those who are visiting, what kind of remedy do they get?
Well, like he had said, basically prevention is still the mainstay.
Okay.
For in the environment now, people can be immunized. There are oral vaccines that can be given to people from the Global Task Force on cholera control, that by year 2030, 90% of cholera deaths should have reduced, and they should have been eliminated in like 20 countries. It's endemic in this country. So, and that's the way we're going to get over it. But prevention still takes more important role, not just vaccination alone. Because when people don't have access to adequate and portable water supply, and when in environments when there's poor drainage, when surface water contaminates what people take, people are bound to come down with this, even when they're vaccinated. That's why when you see what the WHO talks about it talks about the mainstay is prevention, and people should be educated enough, good hygiene, good sanitation, and it's going to come down.
Well, in as much as these people found themselves in IDP, of course, IDP camps and all other kind of settlements that are not conducive enough, we can't blame them entirely. But what more can we do as a government? Definitely, because we've talked about the issue of prevention. Last week, Thursday, the president had to declare a state of emergency on that's water hygiene and sanitation, and we know, especially for water. And what more can we do to actually help stem this tide? Dr.
Well, health education is something we have to continue doing in our health facilities, in our churches, in our mosques. We have to continue to preach about how to take care of personal hygiene. It has to be a habit of everybody that when you go to the toilet, you finish, you must have to wash your hands. Not just wash your hands, but with soap, with detergent, with anything that can kill bacteria. And also to make sure that the water we drink is purified, potable water, meaning it is safe. It is free of contamination, free of the bacteria. People are looking for
serious water. Well, we get it purified from doctor.
And that's where the problem. That's where the problem really is.
It's a great concern.
But more importantly, when there's a case of 1 or 2 persons that have come down with cholera, other people need to move away from those people and the cases have to be reported to the health facility, nearest health facility, as soon as possible, rather than taking care of themselves or self-medication. They should make sure that the health worker is notified, the health worker is involved in the management of the patient, and the patient should be isolated. What is
because
bad?
it can definitely
Yes, yes,
contaminable disease.
yes,
Okay,
yes.
so no need for sharing of things around each other?
No, they should, other people in the house should not drink from the same cup. It is not airborne, but it's waterborne.
Okay.
And they should not share the same food, or like biting, eating together. Anybody that is already affected should be isolated, and other people in the family should take extra caution. What do I mean by that? Make sure you bathe properly, and make sure that the water, even that you use in bathing, is disinfected with Dettol, with Izal.
Antiseptics, generally.
Yes, generally. I mean, I'm talking of the ones that are common, that everybody can find.
Those people didn't pay me.
That everybody can find.
Well.
And make sure that the food you eat is well cooked, and the water, if need be, when you are in an endemic place and your water is not potable water, in other words, it is not treated water from any source. You need to boil that water and let it cool, and then you drink. You have to make sure too that all the food that you eat is clean. Wash your plates, wash your utensils, wash raw food that you must have to eat raw, like fruits. If you have to take banana, for example, hold a banana, peel it off, and bite the inside. And make sure that that's if you don't have water and you must have to eat. But
it's better you even wash such fruits and even
yes,
in the first instance.
in the event that you don't have water, you still have to do the best you can to clean the fruit that you are eating. You can use paper, you can use towel, you can use handkerchief to clean it. But that's not enough. The best thing actually is to wash with water. Where you don't have disinfectant, you can use salt. Put plenty of salt in water, put the fruit inside, and wash it.
Okay.
And if need be, wash it more than once before you eat. But also make sure that your food is properly cooked and your water is also boiled. And anybody that comes down with vomiting, profuse vomiting and diarrhea, whatever is vomited and the defecation too should be well taken care of and disposed properly, so that other people don't come in contact with it and get down with the...
All right, Dr. Kedra, I know you're itching to say something. Gentlemen, we'll take a pause here. We'll take a look at some residents that we spoke to earlier, what they know about cholera and its own management. So let's see what they understand about our topic for the day. We'll be right back to take a look at some other areas that we can actually watch out for people coming down and how to actually stem the tide of this epidemic. The program is Nigeria Today, and we're discussing updates on cholera in Nigeria. Yes, we talked to some Nigerians earlier. Let's get to the straight now.
Cholera could be anywhere. If your environment is not clean, you can have cholera.
Our environments are clean. Two, our domestic water and other activities are well kept. I mean conserved without any contamination.
To cholera outbreak. So we need to tidy up our neighborhood, dispose waste appropriately, and feces and other waste.
Maintain good hygiene. The environment, the food we eat, and everything. Avoid contaminated foods and those and so forth.
The government has to do something about distribution of potable water.
Well, everyone seems to agree to the fact that clean water or potable water, clean environment is sure clean ground for public health. Let's get back to you, Dr. Okediru. I know some of the health institutions, I don't know what your area of movement definitely, but moving from one health facility to another, especially in the rural communities, we get some of these places even non-existent for most of the people who are supposed to be assessing them. How does that actually get the people in trouble? Sorry if I may, for lack of words to use, but actually, how do we get the public health facility across to those who really need them, especially now that we have this high number in different states?
Well, the government is doing what they could do, and part of what, as public health physicians, as health experts, you are not supposed to be glued to a particular place. You should, it's an itinerant profession. You move from one place to another. And from my short experience with what I've been able to do so far, I'm just talking from personal experience, we've been able to go to interiors to talk about hygiene to people. It's very important people are educated, because when you talk to them about what to do and they are not empowered, that is where the problem comes from. So basically, is
that what you've seen so far? Because we're curious. So, okay, why should we have this high number? 29 out of 36 states is a high number.
Well, like I said earlier, it's an hygiene situation. When it is not available, the little that is available is people have overwhelmed it. That's where the problem lies. So where particularly sinking of boreholes where potable water are not available, talking to people when they have the little one they have access to. Even if it is just a well, there's sanitary well, and there's a way to take care of it. You sieve the water that you have, even when you get it from, you boil it, you put chlorine. Those are basic things. They are very cheap, and they are distributed by organizations, NGOs, governments. They give it to the rural people.
What about sanitary conditions, especially use of, what we'll talk about open defecation, which is what I think was even the other topic we had to look at that time. People openly do this. Are they not concerned about, okay, even if it's not about cholera, but even doing that in the open, how does it all go well for those places that you visited? What kind of explanation they get to give to you as you move around?
Well, so when you go to some environments, there are a lot of myths. And that is why the health experts have to come in to debunk this. Gathering people together for community participation. Because if you come, you want to give them any project and they are not involved in which, most likely there will be issues. And from experience to my little experience, we found out that even sinking sanitary toilets for people, they may decide not to use it. Because they may tell you are sinking on the land that is tabooed, or you are sinking it too far away from them. You are digging it for them too far, so they will still prefer to go with the open defecation. So when people are engaged, there's community mobilization. This thing, when it comes to them, they use it. From what I've seen again, we've adopted some villages through some of my social clubs, and we found out that when we go there, this is what you need, and they are brought into it. Just digging of a sanitary well will negate against people defecating in the open. Okay,
Dr. Boja, share your experience with us, because this is one key area that we know, once we can actually cover that, perhaps half of this issue will be solved.
Yes, we still have a lot of bad sanitary conditions. If you go to our markets, for example, and you see where foods are sold, things like fruits, things like meat, a lot of the food that we don't necessarily boil or cook before we eat. We've talked of open defecation, and lately we've been experiencing flooding in many states. This is one good source of or cause of cholera. Because when there's flooding, even the previously safe source of water becomes contaminated. And many times, the water that people drink is what they can see, not necessarily what they should drink. And the one they bathe with is the same. But by the way, let me correct something. It is not every case of diarrhea that is cholera. If it is not caused by a bacteria called Vibrio cholerae, it is not cholera. But that is for the medical people. For the layman, the symptoms, like doctor had just explained, are profuse diarrhea, vomiting, fever many times, joint pains can follow. The person can go into coma becomes
As if
very
not treated in time.
Becomes very severely dehydrated, and they can go. And when once there is one case of severe diarrhea, people should suspect and try to do the much that they can to make sure that the vomitus is
how long should they wait before they raise this alarm? Once the person has brought out from like how many times?
More than 3 times in a day.
Okay.
Any diarrhea more than 3 times in a day is considered serious, especially if it does not only affect one person. There are other people affected, and it is usually very serious with children because their bodies are small. Protecting them is more difficult than adults, and so on. So when once that happens and you try the normal oral rehydration solution and it does not help, you should seek help as fast as possible. Unfortunately, there are lots of places where the health facilities are not functional 24 hours.
Which was why I was asking your experiences now, because we want to find out some of these areas are mostly rural areas where local governments are supposed to be attending to this one. So how do they come in?
One of the things that we must have to do when you don't have public facilities or even private facilities available, look inwards in your own house. What is it that you can do in your house that can prevent diarrhea generally? Cholera in particular, in this case, because we are talking of cholera. And if after prevention or an attempt to prevent, there is still a case of cholera, for example, how do you minimize the effect such that people don't die from it? Those are the things that we are talking about. Make sure that first the water that you drink is boiled. Make sure that you bathe properly, make sure your clothes are washed, and make sure that your hands are washed every time you go to the toilet. And the person taking care of the patient that has cholera has to also take care of himself or herself, and make sure that anytime there's suspicion of any form of disease generally, the people that are around that patient, especially if it's a disease that can spread like cholera, should take care of themselves, should make sure that every step that should be taken to prevent that disease is taken. In the case of cholera, drinking water, personal hygiene, sanitary hygiene, environmental hygiene. Look around your environment. If there are stagnant water everywhere, flies are perching on those stagnant water, coming to eat your food with you, to perch on your food and going back again, that's also a mode of transmission. And people getting in very close to patients that have a problem, like in the case of cholera. Say, for example, if you were a mother and you were nursing a baby that has cholera, chances of your coming down with it is very high. Unless you take very good care of yourself and of that baby also. And that's why we say that when once there's a case in a particular place, let the others move away from that patient or those patients that are already involved.
Dr. Kidiro, last word, because I still ask, even though Dr. Egoja didn't take care of that part so effectively, local government areas, these are some of, because I keep going back there because we know some of these cases of the camps, IDP camps, they're situated in the local government areas, and even for those who are in some maybe towns, at least their area council will actually monitor such. How should they come in to actually help?
Well, it is an issue of primary health care, and primary care, they take care of, the local government takes care of the primary health care. Likewise, the government from the federation, the federal government through the Minister of Health, have been, there are so many primary care centers that are now being instituted. But for the local government, they have to be empowered there. For primary care, we have village health workers, we have the CHILs that can come into the community. Even most of them, they should be visiting. They go into the community to find out what the problem is and bring the information back to the facility. So through this, if they are empowered more, if more of them are recruited and they are well trained, they can go into the community where the IDPs, they educate them, and they bring out issues. The water can be tested as little as it is. The local government can supply chlorine to the community, to where the IDPs, to where people are internally displaced, give them chlorine to treat the water that they have to drink, and make sure that open defecation is a no-no.
Very key. Thank you very much, Dr. James Okediro, public health physician. Thank you for coming on the program this evening. We also like to appreciate Dr. Isaac Ebuja, another public health expert. We appreciate your insights. We also like to thank you for your time. Remember, you can watch this edition or any other edition online at youtube.com/NTA News 24. My name is Blessing Abu. Tomorrow is another time to join us for a fresh edition of the program. Enjoy the rest of your day.